Hello, I'm Sarah Jamieson and I'm the Head of Midwifery, and I'd like to talk you through our presentation on our transitional model for our midwife-led units.
In introducing it, we have advised the Trust Board on the 29th of June of the risks being balanced within our maternity services and those that are having the greatest impact. We wish to deliver a proposed transitional model which would span approximately 3 to 6 months. We advise the clinical commissioning groups as they are carrying out a midwife-led unit review into our ongoing services and their sustainability, and that seeks to provide a medium to long-term plan in addition to strategic planning work by the local maternity systems, our LMS. These proposed changes within our transitional model do not preempt the outcome of either of these reviews. The current risks and challenges that we face are predominantly to do with activity and our staffing. What you will see in the presentation is that births have steadily declined since 2008 in our midwife-led units. This means that in our outlying midwife-led units in Ludlow, Bridgnorth and Oswestry, we are now seeing just 3.4% of our population giving birth there, and 85% of our population giving birth within our consultant unit. The next slide gives you more information on the birth numbers since 2008 through to year 16-17, and birth numbers have generally increased for our consultant unit in Telford and declined in our midwife-led units, particularly in our smaller midwife-led units in Oswestry, Bridgnorth and Ludlow. This decline hasn't been dramatic, but over a long period of time there is a general decline in the number of births in our midwife-led units. Our current midwifery staffing model does not reflect or address the service demands, and we have seen a migration from community and midwife-led unit births to the consultant unit over a number of years. Some of this is due to choice, and also it is due to an increase in risk status. Our recent birth rate plus results has shown us that our current model does not support our activity. The report advises us that staffing levels are higher within the 3 smaller MLUs, Oswestry, Ludlow and Bridgnorth, than the activity requires. And it advises also that we should seek to redistribute staff in addition to recruiting more staff. The service is experiencing a fragility within the workforce. Sickness, absence and increasing demand means that services are affected and staff need to be redistributed on an ad hoc basis. Short-term sickness is the primary cause of utilising the escalation policy. This situation creates pressure and leads to instability in staffing plans, which impacts not only on the consultant unit, where sickness absence is occurring, but also on the midwife-led units, as staff allocated to these areas are consistently being reallocated from the midwife-led units to work on the consultant unit. We have agreed internally to an over-recruitment to enable us to stabilise the workforce, and whilst we have considered agency, it should be noted that maternity services do not historically use agency to cover, and we rely on the goodwill of our experienced workforce. In terms of our expectant mothers and their families, it's important to remember that increasing use of our escalation policy is disruptive, gives lack of continuity of care, and ultimately a lack of confidence in the service. We have seen and we have heard about increased anxiety affecting mothers from both MLUs and the consultant unit. NICE Safer Staffing Guidance in 2015 and Birth Rate Plus, along with the Royal College of Midwives in 2012, recommend a birth to midwife ratio of 1 midwife to 35 births for freestanding midwife-led units and 1 midwife to 28 births for delivery suites, and we are currently not achieving that within our service. The proposed transitional model, which has now been implemented and was approved on the 29th of June by our Trust Board, means that inpatient and overnight provision is suspended in 3 of our smaller midwife-led units with the least birth activity, and those are Ludlow, Bridgnorth and Oswestry. This will be for an initial period of 3 months, and this started on the 1st of July 2017. After this initial 3 months, our Trust Board will review our progress and consider whether or not our transitional model should continue for a period of up to a further 3 months. All day services will remain the same. All community antenatal and postnatal care will continue to be provided either within the unit during the day or in the community. However, women will not, during this period, be able to give birth in these units or to be transferred to them for their postnatal care. For care in labour, we call that intrapartum care, all women will be offered birth in either the Royal Shrewsbury Hospital or Princess Royal Hospital midwife-led units or the consultant unit. In some areas, women may wish to give birth outside of our county because of where they live. For example, either Wrexham, Hereford or another unit of their choosing. Women will, however, still be able to receive all of their community postnatal care from their local unit, either in it, during the day or in their home. Additionally, women can still choose to have a home birth, and this will continue to be facilitated in line with current choices. This model will mean that we release 3 midwives and 3 support workers per night, and these will be redistributed in a planned rather than a reactive way to areas of high demand on the consultant unit and possibly the other midwife-led units where we are also experiencing shortages of staff. By taking this action, we introduce certainty for mums-to-be and midwifery services over the next 90 days. The Trust will use this time with our commissioners and the LMF to develop a new model of care, fully staffed, to avoid further anxiety for our population and to allow our people to return to a positive place in delivering the safest, kindest care possible for our mums, babies and families.